Hi, happy Sunday, and welcome back to another episode of The Empowered Path. I'm really excited to have Jessica Evelyn here with us this morning. She is the owner of Soul Level Wellness. She provides Reiki and sound healing in Nashua. She has an office and she does sound healing at Sacred Moon. I've known Jessica for a couple years now. I think
Yep.
it was the app that officially connected us.
Yeah. Yeah.
Well,
And other, people that we mutually know.
yeah.
And then because I mutually knew them, I would see some of your stuff pop up on Facebook and I'm like, I really need to go check out Sacred Moon. So yeah.
Yeah. Yeah, I love when that happens.
Yeah.
So, today, if you didn't see the Facebook post, we're going to talk about some all things medical gaslighting and food and diets. And Jessica has a really empowering story about that. So, I will let her start.
Yeah. So first of all, I'm so happy to be here. I feel like some of the stuff I'm going to talk about is not talked about a lot, especially in past history, but being talked more about now, because some of the stuff is finally coming to light, and people are starting to not be afraid to talk about it. So to start off, my story began as a child. I live with autoimmune disease. I have Crohn's slash ulcerative colitis because I was diagnosed with UC first. And
At what
uh,
age?
at 7,
Yeah.
at 7. But as I was actually telling Amy just a few moments ago, I believe it started so much sooner than that. As a child, as an infant, I couldn't handle my mom's breast milk. From what I remember, if she tried to do that, I couldn't handle the formula that she put me on either. And I do remember her saying I had to go on to some type of, not super special, but just a certain brand, something like that, because I was not handling formula well. And then, got that under control. Fast forward, pretty healthy childhood. I was the tallest in my class, in second grade. Um, was developing fine until age 7. I got really sick, really quickly, and it was all GI related. And I remember it was October. I remember going trick or treating with some of my friends and literally turning around to their parents and being like, I can't do this right now. I need to go back to the house. And that turned into finding out that I was constipated. Did a whole bunch of things to try to fix that. It took a few days. Once I finally was able to go, my mom was like, great, she'll feel better. But I didn't get better. I still was having GI issues. So fast forward, between ages 7 and 13, 14, I was in and out of hospitals. I was getting lab work after lab work. I was on medication after medication, steroids, like prednisone specifically, which is it does what it needs to do. But long-term use of any steroid is not good. It causes heart issues. It causes other issues within the body. So anytime I would get a flare, they would put me on prednisone to control the flare. And then they would, move me to a different med because clearly the med that I was on wasn't working anymore if I went into a flare. So by 13, 14, I had gone through all the meds that were available for EUC. And there was at this point, there was one other thing. It was a medication that you had to start intravenous with an IV. So I was hospitalized for a couple of days because you need to be monitored on it. And then I could go home on an oral dose. And that was I want to say one of the first biologic treatments that was around. It's called Remicade, and it's still around today in the same family as Humira. A lot of people are more familiar with Humira being a self-injection that you give. It's a biologic treatment. It blocks the immune system from working too much, basically. Because what autoimmune is your immune system is actually working too well, and it's attacking your healthy tissue. So a lot of people are under the misconception that people who have autoimmune means our immune systems aren't working. They are working. They're working too well.
Yeah, and they're killing all the good bacteria.
Yes, it's killing all of the healthy tissue, organ, bacteria, depending on what autoimmune disease you have.
I want to stop you just for a second because I
Yeah.
think this is important into the line of work that you went, right? So, from the ages 7 and 13, what we know about development and emotional development and sense of safety and being in and out of the hospital, questioning, not knowing. How was that at school? Like, how was that? Because I feel like a lot of people might relate to something like that going through, or right now having a child
Yeah.
going through something like this, because I know that there is so many kids out there that are having gluten allergies and all these allergies, and they're having to go to school and they have to have something separate. Like
Yeah.
maybe even some advice you could give to a parent on what you may have needed for support in there.
Yeah, I mean, so I give so much credit to my mom, and she's probably watching this, which I think is wonderful. But she was my advocate through all of this because as a child, you know, one, I wasn't able to advocate for myself. I didn't even know what was happening in my own body. My mom was the one who had to digest all of that information. And then my mom being a woman of science, literally having a degree in science, I know that she also kind of like did a little bit of her own research. I know she didn't always just blindly go by what the doctor said.
I think that's really important.
Yeah, she wrote everything down too.
A mother's intuition is usually something to
Oh
follow.
yeah.
And a lot of the doctors, they're, just reading symptoms and they don't know what's actually happening at home. Or so,
Right.
in a lot
Right.
of stories, I hear so many stories of this. And, and I help a lot of people move through medical gaslighting, being told they have something that they didn't, being told, oh no, this is what's wrong with you. And it's something different and you're
Right,
trying to
yeah.
explain that. And so there's a lot of trauma that
Yes.
comes along with that, and a lot of disempowerment of mother's wisdom and mother's intuition. So if you're
Yep.
a mom out there and this is happening and you're questioning it, never doubt yourself for questioning that kind of stuff, because you actually do know more sometimes than the doctors know. They're just making educated guesses, which isn't their fault. They go to school for a long time, but
Yep. Yep. I mean, most doctors and nurses in the field don't get into it because they know that it's a broken system. They do it because they do want to help people. Unfortunately, there's other things that get in the way of that, like big pharma and insurance, which we'll put that to the side for now. But to go back to, what you were saying about the trauma that comes with that. So I had to rely on my mom, and I had to rely that my mom and my dad were making decisions that were best for me, because even though it was being explained to me by the doctors, by a nurse, by my parents, again, in more probably terms I could understand, it was still like, how do you wrap your head around that when you're in school? Like I was in middle school going through some of this stuff. So, and I'm also an only child. So the only support I had at home were my parents, but I also feel really blessed because the friends that I had rallied around me. Any of my, like, when I was sick and on prednisone, my cheeks would get puffy. They call it moon face. And there were kids who would make fun of me. And my friends, God love them, like, they were willing to, like, bump heads with somebody to be like, don't you effing talk about Jess like that. She is the best human around. Like, you don't know what you're talking about. And I love all of them. Most of them I'm not even still connected with, but, like, I still think about all of you guys all the time. So if anybody does see this floating around, all my friends in middle school and high school, I'm so grateful for all of you guys, really am. But yeah, so like my mom and my dad had to make all these decisions. So this means like going to the doctor, having all these labs done, and I'm like, you're not sticking a needle in me. Like, no. I remember one of the first labs that they needed to do, like literally two nurses kind of had to like hold me down so that they could my mom was there, like my mom's trying to calm me down, and I'm like, you're not coming at me with a needle. Like I had no idea what was happening. So I was on certain types of medications that I had side effects from. I don't remember exactly the name of the med, but it gave me migraines to the point that I would vomit and then I would pass out for hours. And like as soon as the migraine came, I couldn't do anything. I couldn't, like, the blinding light and the aura that you get when you have migraines, I couldn't open my eyes. And so I missed a lot of school as a kid too. So talking about the social aspect of that, emotionally and socially, I definitely was not as mature as I was about other things, like about my health and stuff. I had to be more mature. I had to
Hmm.
understand what was happening, and I had to. My parents always asked me, about my opinion, but I obviously went with what they wanted me to go with because I had to trust them, and they did everything to the best of their knowledge with what information they had at the time. And there's a lot more research now. There's a lot more medications, drugs, treatments, whatever you want to call it, for UC, Crohn's, and other autoimmune disease than there were back then. Um, but yeah, like being in the hospital for weeks at a time and like being at the mercy of nurses, and like my mom did a lot. She would ask like, where's the fridge so I can get her water or a juice, or like she would take me to, because I was in a pediatric wing of a hospital. So there'd be like a little library or like something with
Yeah.
games that you could go to. And so instead of always relying on a nurse or an LNA to take me, like my mom would take me. So she was doing the work of so many people
Yeah.
alongside the nurses. The nurses were great. But I imagine that my mom also has some trauma about all of that. Because like when she knows that I'm sick and I call her, I know that that call is probably an immediate, like, I hope it's an okay call, not like I need to go to the hospital call, because she's gotten those, especially like at 3 in the morning. So usually if I'm calling her that early in the morning, she knows it's not good. So I know that there's some trauma there. But for me, like, yes, a lot of, and I've worked through a lot of that trauma in EMDR. So I don't portray it as much. People don't see it as much, and I don't feel it as much anymore. But
Well, it's also really a testament to the healing journey because a lot of people go through that stuff as a child and then they have that idea that the time
mhm,
heals the wounds and they may have gotten it under control, but like they actually never went back to re-feel
yep,
what was happening in that time, right?
yeah,
Especially in such a major developmental time if you have it as a child,
hmm,
and that it'll come up in your adulthood, or even the parent of a sick child doesn't want
yes,
to go back because we actually don't want to go back there. We think
no,
that, right? But it's the thing about we have to refeel it
yeah,
to heal it. And it
hmm,
doesn't mean that we have to relive it. And I think that that's where people get so caught up in thinking that they'll like
yeah,
actually have to go back. You kind of, it's like halfway reliving it. You have to refeel it. But it's so important because it will
yep.
dictate so many ways you operate as an adult.
Yeah. So to speak to that part, what EMDR initially does is, so when we are, because of course I have a mental health degree, I have a psychology degree, and I've been in the mental health field for about 14 years. So I'm really familiar, and being in the profession, I'm always going to be the last person that I notice who needs the help. So it has taken me a while to go on that healing journey, because at one point I was putting the focus on everybody else who needed help instead of the help that I needed. And that's just a realization that, when people do, they're like, oh, wow, I needed some of those things that I provided to other people.
Well, when you're in it, that's what we don't realize is that when we're in those situations from 7 to 13, when your mom was doing it, you're in it, so you're feeling it, but not, it's
Yep.
like a surface level because you
Oh,
still have
yeah.
to go about your
Your
day and
day.
do all the things. And then that's the same thing that happens. You continue life because life is always lifing. You're never not
Mm.
having shit in life, things happening. So you don't realize that you really have to take the time to actually go back and feel what you didn't feel in there, or
Right.
for you didn't know how to because you were a child.
Yeah. Yeah. So I think, you know, dealing with the trauma, you have to reprocess it. So EMDR is a good way to kind of at least start. It's not for everybody. So I'm going to go out there and say that it's not for everybody. And you have to be ready to do EMDR, and you have to have skills, because things are going to come up that you have to work through. And the person who, the therapist who's doing it with you is going to coach you through that, but like you also need to have a certain set of skills, or coping skills specifically, to be able to handle some of that stuff. So it's not for everybody, but it mimics what happens in REM sleep. So in REM sleep, which a lot of us don't really get into, REM sleep helps our brain reprocess information that we got throughout the day. And when there's trauma, your brain isn't reprocessing the information appropriately in REM sleep. So you hold on to it and it goes it lives in other parts of the body. It can it can show up as anxiety, depression, all these other things, right? So, and everybody feels it. Like for me, my anxiety is in my chest always. It's this like really fast heartbeat, and like to the point sometimes when I go into like a panic attack, I'm like, am I having a heart attack? I know I'm not. I know that it's a panic attack, but like that's what it feels like for some people. And I work in a hospital. I've seen people come into the ER because they think that they're having a heart attack and they're having a panic attack. So, so it's important to be able to go through that trauma and reprocess it appropriately, because that's how you heal from it. So yes, we do have to relive it, and some people aren't ready for that. Um, but then going back to like my childhood, right? So between 7 and 13, 14, like 13, 14, I was starting to go into high school. And high school is kind of where you start to like think about who you are as a person and what you want to do with your life, because after high school, you're kind of expected, or you used to be expected, to either go to college or to go to like a trade, right? So you're sitting here in college and you're trying to think about who you are, but this entire time frame of my childhood, I was sick and I didn't get to experience things that other kids got to experience. So even just like emotionally, like friendship level speaking, I had a great group of friends, but I also didn't like mature emotionally as quickly as some of them did. And I noticed that more in my adult life with like my relationships, like my romantic relationships, more so because friends don't tend to get into the same kind of like arguments that you would get into with somebody that you are dating or living besides a roommate, living with. And I know that like early in my specific journey, I got married really young, and I probably shouldn't have. And that's a piece of like my brain didn't think about it, because from 7 to 13, I was just trying to survive. So I didn't learn any of that like emotional, how to build a good relationship, what a good relationship looks like, what's important in a relationship, or what are the flags. Like because I didn't date when I was sick. I didn't date anybody until I was healthy, and I didn't become healthy until I was really an adult.
I don't think a lot of us learned that. I don't think that was something anybody was teaching.
So
But I get it.
right, like in high school people dated, and you start to learn some of that stuff, but like I was too, yeah, I had crushes, and I did have like a little fling that wasn't really that great. It ended very badly, which is actually why I got into psychology in the first place. So see, it does come from full circle a little bit. So I did experience something in high school that made me want to go into psychology more, but um and I didn't even really see my friends and how they interacted with in their relationships, because they would, when I hung out with them, Jess is always sick. When we hang out with her, we wanted to like forget the significant other. Like we want to hang out with Jess. So like I never really, unless it was a group gathering, I didn't really hang out with my friends' significant others either. So I didn't even, all I saw were my interactions between like my parents, and my, other family, cousins, aunts, uncles, all that stuff. And I mean, everybody's got some type of dysfunction in their family. So I thought I knew, but I didn't. As I got older and experienced more relationships and friendships too, friendships that also failed, mainly because I noticed that I was a people pleaser. And which is really ironic, because my mom taught me how to advocate for myself in the medical world, right? So as an adult, when I do feel sick and I go to the hospital or go to the doctor, all my all my doctors know that I'm not just gonna take what they say blindly. I question them, and I argue with them sometimes, and they know that about me now. So they also know that I'm in the mental health field. They know that I've lived experience in the physical health world, and I also work at a hospital. So there is knowledge there, and they know that I'm going to question things and be like, wait, is there another way first before we jump to this med that I really don't want to be on?
I think everybody should be like that
Yes.
now.
And that's the problem, right? Is that people, I shouldn't say it's the whole problem, right? Because some people do that. But then
I don't think a lot of people do though.
no, a lot don't. And
And
the ones that do, they struggle a little bit more because they're willing to stay, and it sounds horrible to say it this way, but like they're willing to still suffer their symptoms or whatever's going on with them to get an answer that makes more sense, which like I agree with. Don't get me wrong. I'll give an example, right? My son just had the flu. I took him to the doctor. Him and I have the same doctor. My PCP is his pediatrician because he does family. However, it was a sick visit, and so it was like a random scheduled appointment with not his provider. And so this doctor knows nothing about me. I'm there for my son, so it's my son's chart that's up, right? He tests positive for the flu. He's like, "Oh, we're going to give him the Theraflu, whatever it's called." And I knew that the next thing he was going to say is that he was going to prescribe it to me too because it can be used as a preventative if caught in the right amount of time. So the fact that we caught it early enough for my son to even get it was kind of a miracle because most of the time people go to the doctor with the flu and it's like, oh, you're already past 72 hours. We can't do anything for you. However, I looked at the doctor and I was like, no, I'm not taking it. And he just kind of like looked at me like, why? And I looked at him and I was like, you're not my doctor, so you don't know this. I was like, but I have Crohn's disease, and that particular drug, like the main side effect is GI upset. And he was like, okay, well, no, that makes sense. So then he's looking in the computer, like, what are other alternatives to this that, that maybe I can take? And he finds I think, I want to say that there might be some random commercial out for it now, but it's basically almost the same exact type of drug. I don't even remember the name of it because I don't care. But it's a one dose, and it's a low one dose, but it's so new that it's so expensive, right? Because it's patented. So it's like a $200 drug. Even with insurance, it can be like a $200 drug. If you don't have insurance, I don't even know what it was. So he's like, you got to use a coupon, da 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 da. I'm a social worker in a hospital, so I'm very familiar with the fact that most people can't afford some of these meds, especially when they're brand new and on a patent, because there's no generic. There won't be one for a while until the patent is really, is up. And some of these drugs, Eliquis specifically, Entresto, these are all heart, anticoagulants. They're all stuff for people who have heart issues. And a lot of these people who have heart issues are on Medicare. And Medicare doesn't pay for a lot of that stuff. Like, I've had to tell elderly people in the hospital that their Eliquis is going to cost them $700 a month. And they're on a fixed income. They're on their Social Security retirement, and they can't afford that. And they cry. Like, they literally cry. And I want to cry with them because it's just it's wrong, right? So go back to my doctor's visit. He goes, well, let's try this. And I was like, well, what are the side effects? Same thing, like GI upset. And I'm like, you can send it to the pharmacy, but I can't promise you I'm going to take it. So I just sat on it. It wasn't available anyway at the pharmacy because it's a brand new drug, and most pharmacies don't just have brand new drugs on hand. They order them when they have to usually special order them. So I knew that even by the time it was available, it wasn't going to matter. The 72 hours would have been up. But let's go back in time. So at 13, 14, that's when I had surgery, like I had said, because all of my treatments had failed me. And notice that I say the treatments failed me. I didn't fail the treatments. We have to watch our mindset here. The treatments failed me. It's not anything that I did. It's not anything, like, yes, there's stuff wrong with my body, but the treatment failed me. I did not fail the treatment. So we need to have more positive mindsets when we talk about some of this stuff. So the only option left was surgery, which my mom did really question before she gave approval. She's like, you need to give me reason before you start cutting out organs out of my daughter. So they did, colonoscopies, all these things, and it was confirmed. They did an endoscopy, they did a colonoscopy, that it was really just located in a portion, a pretty big portion of my large intestine. So the difference between UC and Crohn's is that UC is only in the large intestine. It doesn't deviate from it, it's always there. Where Crohn's can be throughout the entire GI tract. So at that time, for a whole, I think that was about 7 years of my life, they never saw any ulcers anywhere else in my GI tract besides my intestines. So my pediatrician, my GI pediatrician was like 99.8% positive that it was UC, and that if they took out the colon, that I really hate using the word cure, but like that's kind of how they portrayed it. And it's not a cure. I'm going to go out and say it's not a cure. It's definitely a Band-Aid. And I don't fault the pediatrician for this because that's what she knew at the time. Mm. So, and that particular surgery that they did for me had been done well before my time too. I've definitely talked with other people who are older than me and who've had the surgery done well before that I was even born. However, now there's a whole bunch of different types of surgeries you can get. But to make a long story short, they removed my colon, and I did have an ostomy for about, I want to say it was like 5 or 6 months. This was in high school. So again, I got made fun of a lot because I wore overalls to school every day to hide the ostomy bag because I was really self-conscious, and my friends always came to bat for me. So I was so grateful for them.
So during that time, like, because there's parents out here, right, that are going through that, like the support that you got or needed or advice that you could give either a parent or a child that's going through that at that time, because kids are mean.
Yeah.
Like there's not much you can do about that. That's going to happen. That's going to happen whether it's the unfortunate part about school. And like, I have so many friends that are like, a lot of people are taking their kids out of public school, but if your kids are in school, like kids are mean.
Yeah.
And there's nothing we're going to actually do to change that. Right. No. But we just have to support and teach our kids. Yeah. My favorite is hurt people. That's what I always tell my kids.
Yeah. Yeah. So, I feel pretty lucky because I didn't really have to go home to tell my mom a lot of it because my friends kind of handled it for me. But I would say, reach out to your supports and tell them what's happening because, I hear about bullying, right? And we hear that, really sad stories about people who've ended their lives because of bullying and whatnot.
So much high school suicide these days.
And I'm not that I'm old, but I'm going to date myself here too. We didn't have social media like the way that we do now when I was in school. So it was a lot easier to get away from bullying.
I'm so grateful that we did not have social media and phones because the pictures of me, I'm like, oh God.
Yeah. Yeah. Like I remember AIM, like that's probably as close to social media as I got before, Facebook, MySpace, all that stuff became really big. And at that point, I had already had surgery. I had healed from surgery. Like I was pretty healthy. So there was no making fun of me really anymore for any of that stuff. So, but like you got to talk to your support systems and parents, they try, they go to the principal, they go to places within the school system who are supposed to support these things. And the school systems fail either due to lack of staffing. Sometimes it's lack of knowledge too, or both, like lack of knowledgeable staff about what's going on or even how to intervene. And it's not easy because bullies will still be bullies. I worked with a coworker who her daughter was she was bullied. I want to say she's in high school and they went to court over this. Mm-hmm. And it got dragged out for years. And this girl is still bullying her. And I the only thing I think that's really holding my friend's daughter together is her mom and her other friends who are just like, forget her. it hurt people hurt people. Like how that person is acting has nothing to do with you. It has everything to do about themselves and the things
Yeah.
that they don't understand, can't process, or, they don't, maybe they feel that way about themselves. They're projecting it. So have your people rally around you, rally around your friends and your people when you see it happening to them, because I think that's the only way to really prevent it. You have to see there's a silver lining to everything, but you in some situations you really got to look for it.
When you were going through that at that age, like after high school, did you do any kind of therapy or anything? Because I know you obviously you were in the field now, you went to be a therapist, but were you in that kind of, yeah.
Oh yeah, I've been in and out of therapy for most of my life actually. Um I want to say it was shortly after my surgery. I don't remember if it was my PCP or it might have been my GI pediatrician had just recommended to my mom to like maybe put me into therapy just to make sure there wasn't anything underlying anxiety, depression, things that I wouldn't be able to verbalize or like tell somebody about. And I do remember, and like I said, therapy is not for everybody, and it can take a while to find a therapist that clicks with somebody. So you have to not be afraid to go through a few therapists before you find someone that works with you. The hard part about that is when that person that works well with you does leave, then you're stuck again. But like my mom, I don't even remember how we found this person, but she was just definitely not the right therapist for me. So after surgery, I mean, I wasn't really eating. I didn't feel good. Healing from surgery was long. I wasn't eating as much as I did before when I was healthy. And it's like I had a GI surgery. It takes your body time to bounce back from that. So like my digestion was pretty poor. So I wasn't really eating and I was underweight. And I mean, it was noticeable. And this therapist like blatantly asked me at like 13, like if I stick my finger down my throat and make myself throw up. That's not how you should be approaching that. I've like, this was like the second or third time, like we barely built a relationship yet. And you don't just jump to something like that very quickly because there's no trust there to even want to talk about that. I'm going to answer the question. No, I did not do that. I was afraid to eat because I didn't want to throw up because my entire life, every time I ate, I throw up.
I think there's an important point to make too with that is this happens with a lot of different healing practices, right? Like you go to a therapist, you don't get along. So then you're like, oh, checkbox, therapy's bullshit. I'm not going to go back, right? Oh, I went to a yoga class. It didn't make me feel good. I hurt myself. I'm never going back to yoga. Like I went and I did this thing and I didn't like the teacher. I didn't like the people because a lot of, yoga studios, things like that can be stuck up, right?
Yep.
Like you can walk in and you can not feel welcome. And then you're like, I'm never going to go try that anywhere else because I never want to feel like that again.
Right.
So I think it's really important that, people just realize that can happen, right? And it may take you just like dating, right? Like it may take you a few times
Yes.
to find the right fit, and not every teacher is for you and not every studio for you, not every therapist is for you.
Right.
There's a bunch of really good ones that are doing it for the right reasons, and then there's a bunch of people that are doing it just because of for a paycheck, and there's big difference in those things. And
there is, and the biggest difference that you can point out there is it's always the ones who are not in it for the paycheck that actually like do the job the best, really. Not trying to, but that's like they're coming at it from a completely different ethics standpoint there, and it's not just to line their pockets. Like my GI doctor now, I am so grateful for him because and we've had this conversation because he doesn't just come in and is like, oh, what's going on with your GI tract? He knows I have a child. He knows my child's name. He knows what I do for work. He's asked me, I have a patient and I don't know what to do, like, because it was coming from a mental health standpoint. He really didn't know what to do anymore. And he literally was just like, we didn't violate HIPAA, but he was just like, this is what's happening and I don't I don't know how to help her. Do you have suggestions from like a mental health standpoint of things that I can suggest? And so we have like this built relationship, right? And there's always a new drug out. There's always going to be, oh, well, this one doesn't work, so there's a new one. There's more drugs out for Crohn's and UC than I can even count on. I don't even know. Like I just saw a new one yesterday while my boyfriend and I were watching wrestling. So I was like, I've never even heard of this one. He looked at me and was like, this one's new, right? And I was like, I don't even know what this is. So,
And it's wild, the side effects. I saw this, I don't watch a ton of TV, but I was watching a commercial the other day and it was like, may cause death. And it's like,
yes.
oh, you feel good about making a
Mhm.
commercial that literally it's like, oh yeah, you could, you won't have your symptoms, but you could die. So
And my other one that's my favorite part of these commercials, because it's every drug. They say this for everything. Do not take, Xeljanz if you're allergic to Xeljanz. Well, how are you going to know if you're allergic to it unless you take it?
yeah,
But,
none of it really makes sense.
yeah, it
But
doesn't.
we'll get back. So you had your surgery.
Yep.
You weren't eating.
Yes.
Lost lots of weight.
Right. So we were talking about jumping back from all the therapists, right? So obviously
Yeah.
the first therapist was not like, I went to my mom and I was like, this is not work. I like came out in tears. I was like, she asked me if I make myself throw up. I'm pretty sure I literally told her that I was afraid to throw up. So for her to like kind of go and no, I don't. Because I've done that my whole life and I don't want to throw up anymore. So it takes time to find, and we did find a good therapist. And I only did like maybe a couple of months with her because I didn't really need to be in therapy. Even though I had gone through so much at that point in my life, I was still a kid and my brain was still developing. And from her standpoint, like I was pretty on point, maybe a little delayed, like within my own like how I handle my own emotions, which she did give me tips about because I did talk to her about some of that stuff. And then so that ended. And then I went to college and like other things come up. And so I'm like, maybe I should get back into therapy. So yes, I've been in and out of therapy for a good portion of my life. I've made really good strides with some really good therapists. And I've also had, like my first experience with therapy was not good. Like that was my first. So just like you said, like, oh, I'm going to write out. And probably because I was also a kid and I had my mom to be like, no, we can try another one and kind of have that conversation with me. But also I was a minor and she was making decisions for me. But she found me a therapist that did work. So and anybody who is a therapist themselves should, not to say that you have to be, but like should also go through therapy. Some of the things that therapists deal with and talk to their clients about are horrible things that have happened to people. And they're at some point in time, you're going to just remember one client, patient, whatever you call them, and the horrible, like it's just going to stay with you. It is. It's same thing with like police officers who do investigative work and they see things. Same thing with people who are deployed in combat. Like it's all you remember. And even if like I'm not seeing whatever this client is talking about, but they're reliving it as they're telling me it. And I'm watching them disassociate because they're reliving it. And I can feel that. I can feel that energy from them. And it doesn't feel good. And then that sits with you for a little bit. If, and not every single, client or whatever, but usually something that's kind of close to your own, maybe your own story. Or to a parent, that you went through their story with or a friend or something. But there's always going to be that one. And I mean, I've had a couple. Unfortunately, some of them are with my adult clients who have actually passed. And that was, it hit me. It hit me really hard because sometimes you don't see it coming. And
you're human.
Yes.
We're not immune. I
Yeah.
say it all the time. It's like the stuff that I have to witness and see and the work in the line of work that I do and the pain that I,
Right.
get to witness people releasing, like it's a lot. So I have to make sure that,
Yeah.
it's gonna, I'm not I'm not a robot, right?
No, we're
Like
not.
I have a lot of, I have big emotions, right? So you
Me
be
too.
this safe person, a safe space for people
Yes.
to, share in their deepest wounds and pains. And you take on that role deeply because you're comfortable there,
Hmm.
right? Like I'm comfortable in deep wounds. Like
Yep.
I've been there. I see it. I feel it.
Yeah.
And it sometimes strikes my own because I'm human, right?
Yes.
Like
Yes.
we relate. And so we have to make sure we're taking care of ourselves. It's really important.
Yeah. I mean, and that kind of like brings me to why I started Soul Level Wellness. So, which is why I say that the time frame about some of these things that happened to me are really important, right? So, talking about age 13 or 14, I want to say it was like 2002, so like right after 9/11, that I had surgery. And after I had some complications after surgery, but they all kind of got figured out. And by the time I was like a junior, maybe like almost halfway through sophomore year, but from sophomore, junior to senior year, I was pretty healthy for the most part. I was starting to like grow again. It sounds weird, but when your body goes through such a trauma like that, you actually stop growing. Like I
Mm-hmm.
stopped growing. So I went from being like the tallest kid in my class to one of the shortest kids in my class. So you know how sometimes you go home like during high school, like it's summertime, everybody goes home, and then you come back to school and there's always like that one kid who like blew up over summer and they like shot up really tall, or like
Yeah.
for some girls it was like they literally like kind of developed and you were just like, you didn't look like that last year, you know? That kind of happened a little bit cuz like I got healthy, so I started growing again. And I think yeah, like by senior year I kind of started like develop like getting the hips like that a woman, you know, would have.
Yeah.
And so some people were just like, whoa, like what happened to Jess? um but like, you know, so I was healthy, right? I went to college. I had some complications, so I don't think I finished saying, so like I had an ostomy, but they reversed it, so I have an internal pouch which acts as my colon. That mine is called a J pouch. It's shaped as a J. They have a whole bunch of other different ways that you can have internal pouches now. They all have different names. Um, but basically they looped my small intestine, reconnected to down there. I don't want to go into too much graphic detail there,
Does
but
it just stay there forever or do you have to like,
no, it just, yeah, it just
okay.
hang. I mean, most of our organs just kind of hang out
Yeah.
and float around anyway. But yeah, I mean, I don't have an appendix, and there are a lot of people who have had the same surgery as me and think they still have an appendix, but your appendix is actually attached to your colon. So if you don't have a colon, it's gone.
Okay.
um, but yeah, I don't have an appendix. The only part that I have is it's called the sigmoid colon, which is literally just the cuff before you hit your bum. So I had been really healthy, right? Until I want to say like, gosh, we're talking about maybe like 13 or 14 years of being pretty healthy with only a few little, what they call pouchitis flares, where like something I ate set off bacteria, like something happened, and it's usually treated with a quick dose of antibiotics. So I only, you know, I had a few of those. So nothing too major, but when I got pregnant, you know, I went to my OB's office, of course, and I kind of asked him, like, I'm not really sure what this is going to look like with, you know, the health history that I have. Because at one point, my surgeon had told my mom, she actually told her two things. That the type of surgery I had does decrease fertility for women, mainly because like all of our sexual organs are also right next to those, you know, our intestinal organs and stuff. And so mainly from scar tissue, from surgery
Yeah.
specifically, it could affect the tubes. It could affect certain parts of those reproductive organs that could make somebody's fertility less. Um, so that was one thing. So I did go around in life for a while thinking that maybe I couldn't get pregnant. Not that I didn't take precautions to not get pregnant, but at one point I was just like, I've never even had a scare. Like, maybe I just can't.
And that must have, as a mother, for your mom to make that decision, knowing that, the surgery that you had to have
Mm-hmm.
would potentially,
Mm-hmm.
that
And
must,
she talked to me about it. But
yeah,
at 13, I'm like, well, if I die, I'm never going to have children anyway.
right. Or be in the amount of pain that you were in and things like, it's just
Or
kind of one of
if,
those.
I mean, like my body weight too. So like I wasn't having periods. If I'm not having
Mm,
periods, I wasn't going to be able to have children anyway
right.
because those organs and those hormones aren't doing what they need to be doing. But yeah, like my mom had to sit with that. And, but of course, like we're both sitting here like, well, this is the now and that's the later. And if we don't take care of the now, there might not be a later.
Yeah.
Um, so I thought it was kind of like a miracle for me to have my son. But so I asked my OB, like, and he goes, no, there are so many women who have even given birth vaginally. So that was the other thing. My surgeon was like, she'll probably have to have a C-section if she does, because I have a vertical incision. In the pressure of labor, they do talk about like possibly doing damage to that tissue, like hernias, all that kind of stuff. So for some people, it was recommended. We went down the route of I was going to do a regular vaginal delivery until I got into a flare.
Mm,
And so my OB had also told me, and it aligned with what my GI said, that typically what they see is usually like somebody who has either Crohn's or UC, like if they're in an active flare when they get pregnant, it's like one of two things. They either stay in the flare or they actually go into remission. And it's also the same for those who are healthy, who are not currently in a flare, which was me. I was not in a flare. I wasn't on any medications to treat anything of being in a flare. So with my first trimester, I actually felt really great. I felt like a normal human because I still have autoimmune. Like, just because I'm not in a flare doesn't mean that there isn't still, like, I still had a little bit of joint pain. I still had some fatigue. And then for me specifically, your colon is responsible for absorbing a lot of nutrients. So I'm not always getting all the nutrients that I need, which contributes to the joint pain and the fatigue and all that stuff. So, it was my second trimester. Now, I feel like it's information that's finally kind of coming to light, but I was watching a podcast that, was talking a little bit about COVID and where did it actually come from. And it's been found that COVID was actually in the United States a lot sooner than they said it was. So they said it came, I think it was like November or September, November time frame that they thought it was here before it got to the point where we had to do like a shutdown. But we're starting to know that it was actually here during the summer. And a lot of people actually had it and were asymptomatic, which is still the case for a lot of people with COVID still. And so there were probably, millions of people who got it, never knew they had it. They were asymptomatic. They passed it to somebody else well before we were like, hey, something's happening.
mm,
So for me, when I got really sick in my second trimester, I went to the emergency. I called my PCP and they told me I needed to go to the emergency room because of my symptoms. And I didn't really think that it was that big of a deal. I have asthma. So sometimes like when I have a cold, my breathing just isn't great anyway. But the triage nurse was like, it doesn't just sound like an asthma. Like you need to go to the ER. So I go and I get tested for flu, RSV. And I did come back positive with flu type B, but I was sick for 3 weeks. They gave me the Tamiflu too, which I also took, and it made me violently ill, which is why I won't take it ever again. And after that bout of the flu, which I actually think was COVID, because I didn't get out of bed unless it was to like go to the bathroom, and it like physically hurt to move. I remember not really being able to smell anything. And I've never been sick for 3 weeks from the flu. It's usually like a week, maybe. And that didn't feel like a flu. I've had the flu before. And have an autoimmune disease, so I do get hit harder with things typically. And I was just like, this is not the flu. It doesn't feel like the flu. So regardless, I was sick. So there's two parts here, right? So the sickness itself, that virus could have sparked my flare, but there's also that medication that I took that could have sparked my flare because it's known to cause that GI. I hadn't had any GI symptoms from that virus until I took that medicine.
Mm-hmm.
And I went into a flare in my pregnancy, and I had to remain in a flare from the middle of my second trimester until I gave birth because of how far along in my pregnancy I was. They couldn't just introduce a new drug to try to treat this because it was going to affect the baby. So the only thing that they could do was like suppositories or enemas to get it to as close, because what was happening, it was like really close to the bottom of my GI tract, not like anywhere up here. So we did that, which was also really hard because I was pregnant and big. It's not a really comfortable thing to do. And then at that point, I advocated for a C-section with my OB, and he agreed because he was like, I don't want to do any damage to any of the surgery that you've already had that would then constitute you to have another surgery. So we did do a C-section. And my son is here and he's healthy, which is wonderful. And I actually named him Raphael after the Archangel Raphael because he's the Archangel of healing, which actually came to me. I was at work and I wasn't feeling well, and I got like a memory from my Facebook. And it was a time that I was sick, and my mom had sent me the prayer of Archangel Raphael, and like with like a little thing, because I wasn't feeling well, whatever year it was that she sent it to me. And at that time frame, I was trying to figure out what I was going to name my son. And when it popped up, I literally was just like, that's it. That's his name. And I got like goosebumps all over my body. And it was more or less because they have always talked about there being a genetic component to autoimmune. So there was always, I always knew that there was going to be a chance that my child could possibly have what I have. And so I wanted to name him after the angel of healing, hoping that like he's not going to get what I have and that he is going to remain healthy like his father. His father is actually a very healthy human being. But so again, the reason I talk about the time frame, right, is because like I said, I really think I had COVID. And one of the things that I did learn about COVID, the virus itself, is that the way that it was developed was to specifically attack the immune system. And so people who are already immunocompromised, right, we're way more susceptible to this type of virus. And the guy who was being interviewed on this podcast, he was talking about how the virus itself, so, we'll go back a little bit to, we developed a vaccine, right? It's an mRNA vaccine that there's some controversy about and how it could like maybe change DNA. But what this man was saying in the podcast is like the virus itself could probably be doing this. It like strictly attacks our immune system and goes into lymph nodes. Like it does damage to your heart. It does damage to your liver. It does damage to your kidneys. It does damage to your brain. People who have the brain fog from COVID, right? People with long COVID. So we're talking about this virus, something that we've never really seen before, and what it's attacking is something that we've never really seen before. And I feel like we weren't given the truth, right? So here we go. Now we're talking about some of that medical gaslighting. Mm-hmm. We're talking about the fact that when people were starting to get sick, like there were certain medications and certain things that these people could have been using. And we were like, no, that doesn't work. It's not good. We got to use this. Like, remdesivir, or I can't even remember, or I probably wouldn't pronounce it right, but, it's something that you can literally get over the counter. Like Tractor Supply. It was original for horses. I can't remember the name of it, but hydrochlora. It'll come to me. But those were like actually like yes, they were working for people with COVID, but that stuff's already here, and you can't patent it to make more money off of it, right?
Mm-hmm.
So, and that like now that brings me back to like I'm gonna go all the way back, right? So there are other things that we can be doing to keep ourselves healthy. Copper and silver are two metals that we actually need in our body for our bodies to function appropriately. But we're told that there's too much heavy metal, right? Heavy metal's bad. Like, yes, lead is not good. Mercury in high doses is not good. You know, arsenic, there are other things not good, but the synthetic versions of them are not good. The ones that are naturally occurring here, we need. And I did some research, and like we're going back to like bubonic plague era, right? And the people during that time who remained healthy were typically the elite, the ones that had money. Why? Because they were eating off silverware, actual silverware made of silver. Silver is like an antimicrobial, an antibiotic. It's like an anti everything, and it actually used to be prescribed to people a lot back in that time frame. But somebody, you know, Rockefeller, came in, and you can't patent silver because it's naturally occurring here. You can't patent copper. There are health benefits to copper. People who drink out of copper,
Yeah.
you know, water bottles or copper cups, not bes- I like drinking out of copper because it keeps my drink cold longer because it's a metal. But you know what I mean? Like there's health benefits to that. And so basically like over time we're being told like, well, no, that's not good. It's bad. So we need to replace it with something. And so, penicillin was developed as an antibiotic, right? To help fight these bacterial infections. And then other antibiotics were created from that, and we can patent those and we can make money, right? So, but the thing about antibiotics is there's only so many life cycles that a bacteria, you know, so say you get some type of bacterial infection and you have to take penicillin. The next time you get another bacterial infection, they give you penicillin again. They can only do that so many times. And it's roughly, I think, about like 7 or 8 times before your body is like, nope, it's not going to work.
Mm-hmm.
So we're going to see antibiotic resistance. I mean, we're always coming out with more, but the mass use of antibiotics, it's going to fail us at some point. So doing your own research, like there are other ways to fight inflammation. Turmeric, like golden milk. You can literally turmeric, ginger. There's a couple of other herbs that you can get you get in your grocery store, right? Try to get organic, of course. You want to make sure that your stuff is coming from quality, some type of quality somewhere, right? And if you can't. I get it. Not everything we can always find in organic, especially depending on where you're living. But organic is usually always better. Our meat should be grass fed and grass finished. Cows don't eat grain, they eat grass. And so when we have these mass production of meat, like we're feeding grain to all these chickens, these cows, we're trying to get them fat, big, faster so we can butcher them and get them out. But like that's not, we are what we eat, and we're also what we eat and what they ate.
Mm-hmm.
So
I'll tell you this too. I had my gallbladder out. I had to have my gallbladder out when I was pregnant with Zoe. And if I knew what I knew now about what that is, one, it's $1 billion industry. Getting your gallbladder and your appendix out, like when you find that out, it's just like $1 billion industry. So that's the first thing, because they're like, oh, humans don't need an organ, and we'll figure out how we can take it out so we can. The medical bills are crazy, right?
mm-hmm.
And if you're having gallbladder issues, our food isn't bitter anymore. So the gallbladder makes a bile.
Yes.
And the bile needs to be healthy for it to not create gallstones. Yep. And all you need to do is eat bitter food. Like broccoli used to be really bitter. Like vegetables used to be bitter, but now we've made them sweet. So now we don't get So I could have just taken bitters
Mm-hmm.
and like eaten bitter food and made my gall like bile healthy,
Right.
and my gallbladder would have healed itself.
Sure.
And it's like we call these things like alternative medicines, right? Plants and things. It's like no, nope. It's the
It is the original.
original medicine is plants
Oh yeah.
and eating food that isn't poison and things.
Yeah. I mean, so huge believer. My mom has said this from the get-go. God put everything on our green earth that we needed to sustain life.
Mm-hmm.
And somewhere along the line, not all, but we're kind of looking at, and I don't want to get too like religious, but we're kind of looking at like a battle of good and evil, right? So we have these people who are in power who have the ability to make change, but it's the wrong people in power because they are letting the power consume them with like greed, right? Whereas people who truly want to be the change make, like for example, like my GI doctor, he has flat out told me, yeah, I can make more money off of you by pushing a brand new drug that they tell me to push. He's like, but why am I going to take you off of a drug that is working for you just because I'm going to make more money?
I think a lot of people don't know that like doctors
Correct.
get kickbacks
Oh yeah.
when they prescribe certain medicines.
A lot of people don't. A lot of people. So pay attention because they do. So, and question that. Question when your doctor says like, well, I think we should switch you to this, especially if it's something that is working for you. Question it because not all like I said, not all doctors are in this for the right reason. Most of them are, and some of them are just as frustrated with navigating a crappy healthcare system because not one person is going to be able to change it by themselves, right? But there are those doctors out like that. They are in it for the money. They're lazy. They don't want to do the work. They do the bare minimum of their job, type of deal. And I just appreciate like he didn't have to tell me that. He literally did not have to tell me that at all.
Well, I always question because this is a lot, right? Because I worked in the mental health field and treatment, right? So you go and you meet these doctors
Mm-hmm.
and you look at them and you're like, well, are they healthy?
Yeah.
What do they look like, right? What does their skin look like? What is their, like, are they healthy,
Mm-hmm.
right? Because I'm going to this doctor, you're telling me about my health, but you're like overweight.
Yep.
And you're like actually not taking care of your health. What is your outside intake? What does your water intake look like? What are you feeding yourself?
Yeah.
And then you're giving me health advice.
Mm-hmm.
I question that. Like,
Yeah.
why are we not questioning that? It's really hard to
Yes.
find a doctor that cares about their health and
Yeah.
they're just educated on
Mm-hmm.
like in school about these things, but actually aren't embodying any of these things.
Yeah.
And you ask them, well, would you take that medication? Right? And the answer is probably no.
Yeah. Yeah. I mean, 100%, right? Like, so we go back to COVID, right? And we have Dr. Fauci, who was kind of like, this is what we should do and this is what we shouldn't do. And he is a doctor, but like, did you treat anybody with COVID during that time? Did you see what happened to any of those people? Were you in the hospitals watching people get intubated? When we knew that there was other things that we could be doing to fight this, right? Because like, no. And like, yeah, he is a doctor, but like, just kind of like what you see, he's not embodying any of, and granted, like he is a thin man and I mean, he's kind of short, but whatever. So like maybe he is taking care of himself, but like as a professional who knows that there are other things that we could be doing instead of just letting people get intubated and then possibly never be extubated and letting these people die, like why? Like why?
Yeah, we
You
could
know?
go on a lot about that. But so you have your baby because we have like 20
Yeah.
minutes left. You
Yeah.
got to talk about soul wellness.
Sure.
You got to talk about what led you there.
So yeah, what led me to soul wellness was my postpartum, right? Which I knew was probably going to be a little bit harder for me because I do have an autoimmune disease. So I knew my hormones were going to kind of not be great, and they really weren't. And I recognized it. So that was the important thing, is I actually have been in the field long enough that I recognized that I was going through postpartum anxiety, which actually landed me in the hospital with an intestinal blockage. So a big part of why I started Soul Level, right, is because it's not just your physical health or your mental health. It's everything. It's your physical, your emotional, your mental, your spiritual. That's why it's called soul. We're talking about your spiritual soul. We are spiritual beings in a meat suit, you know? So I want people to be able to learn how to heal themselves at a soul level, not just this outside level that we see, right? And in order for, like, I've been through therapy. I did get back into therapy when I was going through that as well, but it wasn't, I don't want to say it wasn't working. It was working and it was helpful, but I felt so hopeless in that time. And I'd never felt that way before, right? Like I've had moments of anxiety. I've had moments of, little, I don't even know that I want to call it depression. It was probably normal sadness that humans feel that is healthy, right? I've never had that like hopelessness. This is never going to end. There's no light at the end of the tunnel, but that's how I felt. More on the anxiety piece than depression, but like I was always worried that my baby was going to stop breathing. Like I was constantly checking, like it was unhealthy what I was doing. I was reliving these situations in my head, like intrusive thoughts, right? Like I had these, why am I thinking about it? I don't know. It just happened. But I would be like, what if I'm driving in the car and we just get hit? We just get hit by a car and like my baby's in the car. Like I just had these awful thoughts that, where are they coming from? And I recognized it. So got into therapy. It took a while. And then I got physically sick, because your gut and your brain, they're connected. And a lot of neurotransmitter receptors actually lie in the gut, specifically serotonin receptors. So for me, I can't just take an SSRI because I have a GI issue. Which is what a lot of, medication professionals would be like, oh, we'll put you on an SSRI. But that didn't work for me. It actually made me sick. So, I finally got hooked up with a psychiatrist. They have a better understanding of the physical body and the brain. So they're going to be able to see your other health issues and know like, well, that's not going to work, but this could work. Because they have the understanding of kind of like how they work together. So he put me back on a med actually that I was on before that helps treat migraines, which I was like, that's fine because I was starting to get migraines again anyway. Do I want to be on this med for the rest of my life? No, I don't. So that's kind of why I started. I was like, I need to do more than just therapy. So Reiki, it's something that I've known has been around. My mom is a massage therapist by trade. She went to school for it. And she was attuned to level 1 in massage therapy. And so like I've always known it's been there because she's talked about it. But I got more exposure to it during the pandemic, right? Because everybody was home. We're all stuck on social media. We're all binge watching shows. And I ended up being a part of a lot of Facebook groups that I'm kind of like, I'm grateful for. One of them being I don't even know what to call it, but she was like doing maybe like a challenge, like a 7-day challenge type of thing. And she had like a new speaker on every day that would go live. And I actually met a really good friend. Her name is also Jess. She was a Reiki master. And I had won like a free session with her. So I got to experience it. And when I say like I got off the table and I had I didn't have any crazy thoughts in my head. And my stomach didn't feel all twisty turny, like how my stomach is, I'm technically still I'm in a controlled flare right now. I've been technically in a controlled flare for a couple of years because I still have active ulcering and stuff. So yeah, when I eat, there's going to be twisty turnies, there's going to be sounds, but like none of that. My body felt so relaxed and I was just like, is this what it feels like to be a normal, right? What's normal? Human being. And so I was like, I want to keep getting sessions. Like that was amazing. So I kept getting sessions with her and I was like, screw this. I want to do it. I want to be able to give myself Reiki, right? So I really started this more for me. But then when I realized how well it was working for me, I was like, I got to share this, So over the course of the last 5 years, I am a Reiki master. I'm not a master teacher yet, but that will be coming down the pike in a little bit. But like when I started, I was just doing stuff for friends and family, mostly distance. Like they'd be like, "Hey, can you just send me a little? Like I'm having a day, or I'm not feeling well." And I mean, like, yeah, and it was free. I didn't ask anybody to send me anything. But then I was like, I kind of want to make this like into a business. I want to offer the services to others that have helped me. And so in that time frame too, right? Not I wasn't just doing Reiki. I was actually going through a meditation teacher certification. So I am a certified meditation teacher, and I use that to kind of start off my Reiki sessions, and I use it to start off some of my sound sessions too. Um, Sound is newer to my practice because I hadn't experienced a sound bath until I had gone to Sacred Moon. And I also hadn't experienced the type of breath work that you do. I've experienced breath work before because it is a form of meditation. So, but not transformational, which I actually like a lot more than other breath work. Um, but I was like, these are all things that have worked really well for me, and they need to be talked about more, and it needs to be offered more, because I know that the East Coast is not as prominent with these things as like the West Coast is. Like
Mm-hmm.
I talk to people from California and they're like, "Oh yeah, Reiki's been out in California for like much longer than you guys are, like really really slow on the uptake." And I didn't realize that, because I've always known that it was there, but they're right, like it wasn't being practiced here.
Mm-hmm.
So that's kind of where I decided I wanted to develop soul level wellness, and the mission has always been to add a mental health piece to it, right? Because that's where I come from, is the mental health world. So eventually, when I do have a space that I can call my own, I would really like to I have some friends. Obviously, I've been in the mental health field. I'd love to have therapists come into the practice and have it just be like a holistic type of, we body, mind, soul, and obviously refer out when we need to, because I don't think that I'm going to have any like doctors in my practice. Maybe some like herbalist or, those type of wellness practitioners. I would love to have a functional medicine doctor maybe,
Mm.
just because they have a better understanding of root cause, or what could be a root cause, and kind of come to a more conclusion rather than just keeping you on meds forever. But I have a bigger vision than what it is right now. And like, I just want to put the resources and the knowledge out there too. Like, we talk about mental health a lot, but like brain health, which is more physical health than the mental piece, right? Our brain is still an organ, and we need things for our brains to function appropriately, like water and food that's not poisoned. A lot of the stuff that we ingest, right? And even just, I sit here with my plastic cup because that's what they give you at Aroma Joe's. Microplastics, they cause cancer. They can cause deficiencies with neuroelasticity and how we process things. Same thing with things that are in our food. Specifically, folic acid is a big one, right? So anytime you look at a box of pasta or some type of grain and it says enriched wheat, it's because it's sprayed with folic acid. Folic acid is the man-made version of folate. So it's a synthetic, we can get it over the counter, but it's synthetic. And they say between 40 to 60% of people can't actually break down folic acid.
Mm.
So what they really need is folate, it's the methylated version of folic acid. It's the naturally bioavailable form of it. That's what our bodies can break down, and that's what our bodies need. But that's not what you see over the counter, unless you literally type in methylfolate or methylated folate. Same thing with multivitamins. You want a methylated version of a multivitamin. And all that means is it's broken down into absorbable, like it's bioavailable immediately,
Right.
instead of our body having to break it down to then be available. And that is for me, especially because I don't have the colon to absorb some of that stuff, like that's more important for me than it is for other people, which is why it's something that I do focus on and I try to tell people about just because it's so prominent in my own life, right? So I notice that I do a lot better when I eat just regular organic pasta. I don't like if I eat, we go to the store and we're just running. Oh no, we have to put dinner on the table and we don't have any pasta. And I run to the store and I just grab, the Barilla, whatever. That's enriched wheat. And I do notice like I get bloated more. I get more gassy and kind of uncomfortable. Whereas eat an organic pasta, it's not as bad for me. A lot of people like doing like chickpea pasta, that type of stuff. That's great too. I just can't eat it because the fiber content is too high. For people who have GI issues, fiber is usually an enemy rather than a friend. A lot of times when people are like constipated, they're like, oh, you need more fiber. For someone with a more normal functioning GI tract, that's true. But for a lot of people with GI issues, we actually need less fiber. Fiber can actually be too rough.
So when you started like doing sound healing and Reiki, were you able to get off the medications that you didn't want to be on? What was the main my brain fog. What was your main like thing that it helped you with the most? Like what was it like, this is it, this is why I want to share it. It helped me. Was it digestive, emotional, physical, body, all of it?
It's all of it. I would say mostly mindset. Right? So mindset is a really big piece of this. And if you have a poor outlook on something, you're going to manifest a poor, outcome.
This is my favorite thing, and this is what doctors do. Oh, you have anxiety. So every day I'm going to take a medication that proves to myself that I have anxiety.
Yes.
And I'm going to identify as a person with anxiety.
Yep. So I'm going to go out and say, no, I'm not off all of my meds. I'm going to be coming off the one for my anxiety specific. So I have to titrate it. So I actually have to go and I have to chat with my doctor because I don't see my psychiatrist anymore. So he has to actually titrate me down because I'll go into like a withdrawal. And it's not a typical SSRI. Like it's I don't even remember what family it's in, but it doesn't, it's amitriptyline. A lot of people are actually on amitriptyline. It actually does have some pretty decent benefits at low doses as well. I'm on like a mid-level dose for the anxiety piece. And the only reason I'm still on it is because if I do not take it like 2 days in a row, I will go through withdrawal to the point that like headache, brain fog, stomach upset, like I can't function like that. So,
yeah. And I think medications are great. I think they're here for a reason.
When you
I don't
need them,
ever say when you need them, but I do like the idea of it not being forever. Like there has to be some sort of end goal. There has to be something else because we weren't designed as human beings to be on that kind of stuff, right? So
yeah. So and yes, there is a space for Western medicine. I don't ever want to like, knock that. I just prefer to do more holistic things before I have to get to that, right?
That's our 10-minute warning.
Okay.
It's like kind of like jarring. You're like, oh.
So, and yes, so like, yes, I was having a really hard time. So with people with anxiety, it's called like a negative feedback loop. So like you kind of can't pull yourself out of it. You just keep going through this like horrible negative thought process, and it's really hard to pull yourself out. And what a lot of what anxiety medication does is it kind of like helps you be able to either pull yourself out or not get into that in the first place. Which is kind of like with the postpartum, right? That's what I was experiencing, was just like this impending doom that like I was going to die or my baby was going to die. Something bad was going to happen, right? So I needed it in that moment for sure. But now I'm like 5 years out from that, right? So one of the reasons I'm still on it is purely the whole, I need to go see my doctor. My PCP will probably do it just because of the relationship that we have, but most of the time it wouldn't be like a PCP would refer you to like a psychiatrist for the most part. Because I would be titrating off of a med, I think that my PCP would be fine doing it, right? So yes, it has gotten me to a point that I can pull myself off of it, because the days where I have not had it, besides just feeling crappy, I have been able to maintain like my anxiety with just normal coping skills, right?
Does that stuff help with your physical symptoms, like
Yes.
for you?
Yeah, because my anxiety is all core based, especially for me. So, and then I'm just going to bring this in really quickly, right? So you were talking about development and how the age, like the time frame, right, that my body was still developing, that I had this going on. So in Reiki, right, we talk about the chakras, and actually your sacral and your solar plexus chakras are developing around that 6, 7, 8-year-old time frame.
Mm-hmm.
So for me, like, it's always my lower chakras that need the work. It's my root. Like, I am not always a grounded individual, which is where some of that anxiety comes from, right? So sacral, like, and solar plexus, those are pertaining to, reproductive organs and our GI organs, and mine were not working appropriately, right? So Reiki has been a huge help for that piece. For me specifically, I don't usually need a whole lot of work on the upper chakras, because I am very spiritual based and I come from a mental health background. And so those things are things that are just very natural to me. I have a big heart. My intuition is pretty strong. I have a pretty, I advocate, I have a pretty strong voice. It's always the solar plexus, the personal power, like, can I do this? That like imposter syndrome, right? And then my sacral, like, I know I have a creative outlet, but I'm not always in flow state. I'm definitely not always in flow state. And so that's like stuff that I need to work on more. And I do when I do give myself self-treatments, that I do work on those areas more. And it's been really helpful. So, I mean, yeah, there's just so many other things that we can do besides the whole, like, here's a pill for that, see you next year. As far as the other two medications that I'm on for the actual Crohn's, I gotta wait. Actually, I have to have a scope done. We'll see what's going on the inside, and if it looks better, I'm sure that, I'll be bringing it up. We'll be talking about coming off of maybe at least one of them.
Yeah, that's amazing.
Yeah.
I was just curious about because I know you had said from the postpartum if this is kind of the path of like wanting to just get off of those.
Oh yeah.
But where can people find you?
So you can find me on Instagram or Facebook, Soul Level Wellness on Facebook. It's also Soul Level Wellness on Instagram, but instead of a dash, it's a under dash. I am renting space from Release Massage Therapy. She is located in Nashua, moving to Merrimack. Actually, this next coming weekend, I'll be helping with that move.
That's exciting.
We'll be right on DW Highway, so main road. You should be able to see us from the road. She offers massage therapy, and she also has an esthetician in there, and then I'm in there for Reiki and sound.
Love that. And she does pop-ups at the studio also.
Yeah.
Yep. So reach out. I'll link her, on the Facebook post. She's on there, and I am eternally grateful to have you have shared your story.
Thank you. I'm so glad to be here.
Pain into purpose, right? That's like what we have two choices. I posted this the other day, right? We have two choices. We either turn our pain into more pain, or we choose to turn our pain into purpose.
Yep.
And, everything has to be transformed. Nothing can be just stopped. So if you have a story that you want to share on here, please reach out. I am booked out for a few months, but also 603 Live podcast. If you want to start your own podcast, you have something to share. They make it the best and easy and convenient. I hope everybody had a beautiful holiday season and have safe plans for the new year. The studio we're going to have our grand opening soon. We're doing a bunch of expansion and all of those things. So keep an eye out on that. And I will talk to everyone. See everyone soon.